Part 1. How does immunotherapy combat cancer? Let's get to know the latest CAR T-cell therapy. Have you heard of CAR T-cell therapy? This is the latest cancer immunotherapy technology. Some even say that this treatment offers the best chance for long-term cancer relief. Is it really so miraculous? Let's get to know the latest immunotherapy, the CAR T-cell therapy. Before we start, let's try a brain exercise. Do you know how our bodies fight cancer? They do so through the immune system. If the human body is a kingdom, the immune system is its defense system, capable of identifying and fending off enemy pathogens. The immune system has two lines of defense. The first is its castle walls. The second is the troops within the walls. The skin, nose hairs, and airway mucosa form the walls, which help block foreign objects or pathogens. The walls alone can't block all the pathogens. When enemy pathogens go across the walls, the troops will take action. The human body has two armed forces. One is the regular army, which has an automated detection function. Its members include granulocytes, macrophages, natural killer cells, and dendritic cells. These are the first to be mobilized to fight the invaders, of which NK cells and dendritic cells are nemeses of cancer cells. NK cells can destroy cancer cells in the body. Dendritic cells can report cancer cell traits to the special forces. Why are there special forces if there is already a regular army? Regular troops act quickly and detect pathogens, but can't target specific enemies or provide long-lasting protection. Special forces made up of B and T cells are needed to pursue and attack powerful enemies. B cells secrete antibodies to attack the enemies, much like launching missiles. T cells act as the central command. In addition to killing pathogens directly and actively seeking out specific cancer cells, they can also call up B cells for backup. These well-trained special forces will memorize enemy characteristics. The next time they meet the same enemy, they can act first and rapidly decimate their opponents. Under normal circumstances, we can rely on these two forces to eradicate the occasional mutant cancer cells. But cancer cells are no pushovers either. They may disguise themselves as friendly cells to evade detection and pursuit. To get the troops back into action, many types of immunotherapies have been developed to help the immune system identify cancer cells and strengthen the immune response in order to exterminate the enemy. CAR T-cell therapy is one such treatment. Immunotherapy comes in many forms. The different forms of immunotherapy are hematopoietic stem cell transplantation, cancer vaccines, antibody drugs, immune drugs, and cell therapy. Let's get to know different immunotherapy methods for the human body. Hematopoietic stem cell transplantation, also known as bone marrow transplantation, acts via transplanted stem cells to develop a brand new immune system, just like bringing in fresh replacement troops. Cancer vaccines. Cancer vaccines can trigger an immune attack against cancer cells. Using the troop's memory, cancer vaccines can achieve a lasting defense. Antibody drugs. Antibody drugs currently come in two forms. The first is the antibody drug conjugate, ADC. Antibody chemo-drug combo targets and kills cancer cells with precision, acting like a poison missile. The second is the bispecific antibody drug. It has an antibody that can capture cancer cells and also call up the T-cell troops of the immune system to improve its effectiveness in killing enemies. Immune checkpoint inhibitors are also known as immune drugs. They can remove the brakes on the T-cells, thus indirectly activating the cells for proactive detection and attack. Cell therapy. Cell therapy differs from the treatments mentioned earlier in that it can be customized. of which cell therapy can be further categorized as being genetically modified or otherwise. Non-genetically modified therapy is known as cell therapy technique. It requires drawing the patient's blood and isolating immune cell troops for ex vivo training. Once the troops have become stronger, they're injected back into the body to destroy cancer cells. Genetically modified therapy is known as chimeric antigen receptor T-cell therapy drugs, which is our focus today, the CAR T-cell therapy. This technique modifies T-cells with radar and mechanical arms outside the body, multiplies them, and then infuses them back into the patient to target cancer cells. Now the troops can more accurately identify and destroy cancer cells. After learning about the connection between immunotherapy and cancer, let's delve into CAR T-cell therapy. Part 2. Delving into CAR T-cell therapy. You might be wondering, why do we develop CAR T-cell therapy when we already have cell therapy techniques for training cells ex vivo? This is because the immune troops in a cancer patient's body may be weaker in constitution. Extra training alone may not achieve the anticipated cancer-killing effect. Therefore, we must rely on genetic modification to improve patients' constitution and fighting capabilities. Currently, the most mature CAR T therapies primarily target B-cell lymphomas. This is because many cancerous B cells have special markers. CAR T-cell therapy helps to equip T-cells in the fighting troops with special arms that can recognize specific markers before they are reinfused into the body. The T-cells can effectively detect and kill cancerous B cells expressing those markers. Therefore, lymphomas such as diffuse large B-cell lymphoma, mantle cell lymphoma, follicular lymphoma, primary mediastinal large B-cell lymphoma, leukemias such as acute lymphoblastic leukemia and multiple myeloma can all benefit from CAR T-cell therapy. Currently, Taiwan has approved diffuse large B-cell lymphoma, acute lymphoblastic leukemia, and follicular lymphoma as its therapeutic indications. CAR T-cell therapy requires a treatment course of about 1.5 months because the process is highly complex and requires strict quality control at every step. First of all, patients must receive leukapheresis at the hospital. This procedure is similar to a platelet donation, in which your blood is drawn and channeled to a machine that isolates the lymphocytes. T cells are then isolated and cultured. After cell isolation, the medical team will cryopreserve the T cells and safely deliver them to a licensed biotech lab. At the lab, it takes 3 to 21 days for the chimeric antigen receptor, or CAR for short, to bind on the T cells to form the chimeric antigen receptor T cells using genetic modification, that is, the CAR T cells. The CAR T cells are cryopreserved again and sent back to the hospital. At this point, CAR T cells can't be reinfused just yet. The patient must first receive lymphodepleting chemotherapy to suppress the potential immune response after infusion. 24 to 36 hours after the lymphodepleting chemotherapy, the medical team will thaw the CAR T cells for infusion into your bloodstream. The CAR T cells can station themselves and tackle cancer cells. As the CAR T cells were modified from the patient's own cells, they can multiply in number and metabolize after reinfusion. So, a one-time treatment will suffice for CAR T cells to remain active in the body. The longer they survive, the better the effect. CAR T cells can travel anywhere within the reach of blood circulation and eradicate cancer cells. Therefore, they are especially effective against systemic blood cancers. As for their disadvantages, only a few medical centers in Taiwan can offer CAR T-cell therapy. CAR T-cell therapy is expensive as it's customized and cannot be mass-produced. Few patients can afford it without NHI copay. Clinical trials or compassionate use are options for patients. CAR T-cell therapy is limited to certain types of cancer, but There are ongoing studies for cell immunotherapies that hold promise for the future. Part 3. CAR T-cell therapy side effects and precautions for care. Although CAR T-cell therapy is a customized and one-time treatment which is very appealing, still there are risks. Next, let's learn about the potential side effects of the CAR T-cell therapy and key points in post-treatment care. Although CAR T-cells are modified from the patient's own cells, when they attack cancer cells, excessive cell multiplication may cause a dramatic immune response. Side effects may develop within approximately 2 weeks after infusion, and they are divided into 3 categories: cytokine release syndrome, ICANS, and hemophagocytic syndrome. CRS primarily manifests as fever, hypotension, shortness of breath, and even coma in severe cases. Research shows that CRS will develop in about 40 to 100% of the patients. ICANS is central neurotoxicity caused by immune cells. Research shows that about 10 to 60% of the patients will develop a varying degree of neurotoxicity. Patients may become rigid, difficult to be responsive, or experience headaches, tremors, irritability, and restlessness, or seizures. In severe cases, because cancer cells gather at the optic nerve, CAR T cells will attack the nerve, causing local inflammation and vision impairment. Hemophagocytic syndrome is an extremely rare side effect. It is due to immune dysfunction caused by abnormally activated white blood cells, where white blood cells attack the body and ingest other blood cells. Symptoms include fever, hepatosplenomegaly, lymphadenopathy, jaundice, and organ failure. These side effects may seem intimidating, but actually, international organizations have already graded CAR T-induced side effects by severity and established treatment guidelines. Medical teams know how to treat different side effects and when to arrange the applicable tests. Conversely, when CAR T cells kill cancerous B cells, they may suppress normal B cell function, thus compromising the immune function. Therefore, after receiving treatment, patients must be especially mindful of their daily care in preventing infection during this time. After receiving the CAR T-cell therapy, apart from taking medication on time and making regular visits to the clinic, patients must also pay attention to 4 major aspects of their daily care. For diet, in addition to drinking lots of water and eating a balanced diet, there is one key principle, that is, don't eat raw food or food that is not fresh, such as unpasteurized cheese or dairy products, raw salads, miso products, or fermented and preserved foods. Even freshly prepared food shouldn't be eaten if it has been left out for over 2 hours. When you eat fruit, we recommend fruits with a thick peel like oranges, watermelons, or bananas. When you want to eat thin-skinned fruit such as grapes, eat canned fruit instead. In addition, avoid alcohol to prevent ethanol from reacting with your medication. Before taking any other medication, consult your doctor first. Do not self-medicate. For attire, wear long sleeves and pants when you head out. Add a hat or a pair of sunglasses when necessary. Avoid sun exposure. For any exposed skin, apply sunscreen with at least SPF 30 or more. For the living environment, remember to maintain a clean and tidy environment. Do not use rugs. In general, avoid animal contact and avoid placing plants indoors as they may carry bacteria. If a family member in the same household has symptoms such as the flu, a rash, or discomfort, wear a face mask and avoid close contact. If someone has just received a live attenuated vaccine such as the BCG, smallpox, or Japanese encephalitis vaccine, avoid contact as well. As for daily activities, after discharge from hospital, rest at home and avoid intense exercise. You must also leave enough time for rest between activities. In general, regular and mild exercise daily can relieve fatigue. If you head outside, avoid taking public transportation or visiting movie theaters, restaurants, shopping centers, and other crowded areas. When walking, keep away from construction sites to avoid dust. While resting at home, cultivate good hygienic and record-keeping habits. Shower daily, wash your hands often, and brush your teeth and rinse your mouth after meals. Measure your temperature and blood pressure at set times twice a day. If you smoke, you must also quit smoking to avoid compromising your immune system. During the home care period, if you experience any of the following symptoms, please contact your doctor promptly. These include fever above 38 degrees Celsius, chills or involuntary shivering, fast or thumping heartbeats, dizziness or lightheadedness, altered mental status such as confusion, headache, blurred vision, or diplopia, difficulty speaking or answering questions, amnesia, severe muscle or joint pain, difficulty breathing, hypotension, more frequent or persistent diarrhea, poor appetite with nausea and vomiting, a stinging or burning sensation when urinating, blood in the urine or stool, purple or red spots or petechiae on the skin, and problems with the central venous catheter, such as catheter dislodgement, loose sutures, inability to flush the catheter, signs of infection such as redness, swelling, fever, pain, or humid, or any other abnormality or chronic symptoms, such as bleeding, rash, diarrhea, and vomiting. As a reminder, after discharge from the hospital, check for neurotoxicity symptoms. Every morning and night, please refer to the immune effector cell encephalopathy score. If your score is below 7, let your medical team know or return to the hospital immediately. If you suddenly experience feebleness, loss of consciousness, or seizures, we also advise you to make a visit to the ER immediately. We hope that this video will help you better understand the CAR T-cell therapy care, avoid unnecessary infections, and handle symptoms more confidently. If you have any other questions, remember to discuss them with your medical team.